Hi folks, my name is David Hannon. I'm an Anaesthesiology and Intensive Care Registrar in Galway University Hospital in Ireland. The video I'm going to show you today will outline the Galway VentShare system for ventilating 2 patients with 1 ventilatory source. This video represents an update because if you've seen previous versions of this video, we mentioned that we're going to develop patient monitoring in greater depth. We've done that now, and I'm going to show you briefly how it works and show you it in operation. So the system as you see it today is driven by an intensive care ventilator. We have tested it on other systems, other ventilators, and found the system to perform equally as well. But for demonstration purposes, I'll direct it to this. This is an intensive care ventilator set up in the following way. Respiratory rate of 14 breaths per minute, inspiratory pressure of 13 centimeters of water, a PEEP of 10, and an FiO2 of 50%. In this configuration, it's connected to 2 patients in the following way. As the gas leaves the ventilator at the beginning of the inspiratory loom, it immediately encounters a Y connector. Then, just after the Y connector, there is an APL valve on each limb of the circuit. This APL valve acts as a variable flow restrictor that allows us to achieve titration of tidal volumes and pressures. So I'll just focus on one limb. Coming around then, we go through standard respiratory tubing and move towards the patient represented by this Tesla. This component is a flow and pressure sensor. We have one of these for each limb of the circuit. So as you can see, it connects by a wire back to this screen. This screen is a Raspberry Pi modified in order to give individualized information about each patient. We have one on this side for our patient A and one on the other side for our patient B. Now details of each of these components, how they operate, where you can source them, are all available on the website that accompany this video in a bit more detail. I'm just going to fly through everything today and show you a little bit about how the system operates. So, patient A, we want to try and get tidal volumes of around 320 mils per breath. We look at the monitor and we can see that we are indeed getting around 320 mils per breath. Looking, however, at patient B, we can see that the target is around 600 mils per breath. And their monitor is showing that they're only getting around 520 mils per breath. What I'm going to demonstrate is one way in which we suggest that you can alter and titrate the volumes and pressures in the system. Obviously, the first order of priority is to increase this patient's tidal volume. Knowing that we're going to increase the pressures in the system, we have to ensure that we protect patient A. So we would suggest something like the following. Put our FiO2 up to 100%, and then in order to protect the lungs of patient A, we'll go to the APL valve and we'll close it slightly, and we'll monitor the effect and ensure that the tidal volumes are indeed reducing. So we can see that they're starting to reduce. We turn now to the main ventilator. The way in which we suggest increasing the tidal volume of the higher of the patients, i.e. the patient who has the greatest tidal volume requirements, is by altering the inspiratory pressure on the ventilator itself. So we'll go to 15 and we'll monitor for the effect of that. As I've said, we know that if we increase the pressure that's driving the entire system, we want to protect the patient on the lower end. We can see after a couple of breaths then the effect of increasing the pressure inspired to 15 centimeters of water is that this patient B, is indeed getting their tidal volume requirements of around 600 mils per breath. Turning our attention now back to patient A, I'll just show you how the APL valve can be used in order to titrate and individualize the tidal volumes on this side. So we can see that the patient is getting ever so slightly higher tidal volumes than we'd like. So we simply close the APL valve and monitor the result. Give it around 3 breaths. 3 or 4 breaths seems to be the delay in the system at the minute. And we'll give this a little bit of time to play out. We can see that the tidal volume is indeed starting to decrease. It's about 315 mils per breath there, 2 to 3.
that tells us that we need to open the valve a little bit and bring ourselves back to the target. And once again, we give around
3 breaths in order to see the true effect. The tidal volume now is around 325 mils per tidal volume. So this represents then the system operating in a way that is pretty ideal for both patients on each limb. This patient is still getting around 600 mils per breath. This patient is getting around 320 mils per breath. Greater details about the protocols that we would recommend that you follow, the way in which we imagine this working in the real world, are available on the website that accompanies this video. That concludes this demonstration.